Prostate cancer is a kind of cancer that develops in the prostate gland, a small walnut-shaped gland in males found below the bladder. Seminal fluid is produced by the prostate gland and is used to nurture and transport sperm. Prostate cancer develops when the cells in the prostate gland begin to grow and replicate uncontrolled, resulting in the formation of a tumor. If cancer cells are not treated, they can spread to other regions of the body, such as the lymph nodes or bones. One of the most common types of cancer among males is prostate cancer. It usually affects older men, and the risk rises with age. While the precise etiology of prostate cancer is unknown, several risk factors such as age, family history, and ethnicity may all play a role in its development. Early-stage prostate cancer frequently does not manifest any symptoms. However, if the cancer advances, it can cause bladder problems such as frequent urination, weak urine flow, blood in the urine, or pain while urinating. Prostate cancer in its advanced stages can cause bone discomfort, weight loss, weariness, and other symptoms. Early detection of prostate cancer is critical for successful treatment and improved outcomes. Men need to be aware of the risk factors, symptoms, and screening options for prostate cancer. Regular discussions with healthcare professionals can help understand individual risk and make informed decisions regarding prostate health. How is prostate cancer diagnosed? Prostate cancer is detected through a mix of screening tests, physical examinations, and other diagnostic procedures. The following are the most popular ways to diagnose prostate cancer. PSA test. The prostate-specific antigen, PSA, test is a blood test that detects the presence of PSA in the body. PSA values that are elevated may indicate the existence of prostate cancer, but more testing is required to confirm the diagnosis. Digital rectal examination, DRE. A healthcare expert does a DRE by inserting a gloved, lubricated finger into the rectum to feel the prostate gland. Atypicalities such as lumps or hard spots may indicate the existence of prostate cancer. Biopsy. If the PSA test or DRE results indicate that prostate cancer is present, a biopsy may be performed. A needle is used to extract a tiny tissue sample from the prostate gland during a biopsy. The sample is then inspected under a microscope to determine the presence of cancer cells. Imaging tests. Ultrasound, magnetic resonance imaging, MRI, or computed tomography, CORT, scans can all be used to visualize the prostate gland and surrounding tissues. These tests can assist in determining the extent or stage of cancer. Gleason score. Following a biopsy, a Gleason score is assigned to the acquired tissue sample. This score shows the cancer cell's aggressiveness or grade. The Gleason score is a number between 2 and 10, with higher values signifying more aggressive cancer. Once prostate cancer is diagnosed, additional tests, such as bone scans or positron emission tomography, PET, scans, may be performed to determine if the cancer has spread to other parts of the body. Relationship between PSA levels and prostate cancer. PSA levels and prostate cancer are connected because the PSA test can give us clues about the possibility of having prostate cancer. When there is an issue with the prostate, such as prostate cancer, the PSA levels in the blood can increase. However, other factors like age, prostate size, and certain medical conditions can also cause elevated PSA levels. If the PSA levels are significantly high or if there are other concerning factors, the doctor may recommend additional tests to confirm or rule out the presence of prostate cancer. Regular monitoring of PSA levels, along with discussions with a healthcare professional, can help guide decisions regarding further testing and appropriate prostate health management. If you have any concerns about your PSA levels or prostate health, it is always a good idea to consult with a healthcare professional. Prostate.
Will you like to start your very own online business with your very own e-commerce store created for you with all the products you ever need, and with a back office that contains all you need to run your business? Sounds interesting? Click link below and start your online business today. Help people live healthier and better lives and make money in the process.
Who should get PSA screening? PSA screening is a test that helps check the levels of something called prostate-specific antigen, PSA, in your serum samples. It's a way to look for possible signs of prostate cancer or keep an eye on how it's progressing. But who needs this test? Well, that depends on a few things, and you should talk to your doctor about it. Usually, men who are 50 years old or older are the ones who get PSA screening. However, some men may need to start earlier, like around 45 years old, if they have a higher chance of getting prostate cancer. This could be because of their race, or if they have close family members who've had prostate cancer. Sometimes, men with symptoms like trouble urinating or other prostate-related problems might also need the test. The decision to get a PSA screening is something you should discuss with your doctor. They'll talk to you about the good things and the not-so-good things about the test. Sometimes, the test might show something that looks like cancer when it's not, which can cause worry and more tests that you might not need. Plus, it can find slow-growing cancers that may not need treatment immediately. That's why it's important to think about your situation and what's best for you. So, if you're wondering about getting a PSA screening, chat with your health physician, and he will consider your age, any risks you might have, any problems you're having, and your overall health. Your doctor can then figure out if PSA screening is something that makes sense for you. PSA and other medical conditions. Sometimes, PSA levels can be affected by medical conditions that are not related to cancer. It's important to consider these conditions when interpreting PSA results to avoid unnecessary worries or misunderstandings. Here are a few things to know. Enlarged prostate. Sometimes, the prostate gland can get bigger but not because of cancer. This condition, called benign prostatic hyperplasia, BPH, can cause higher PSA levels due to the enlarged gland. Prostatitis. When the prostate gland gets inflamed or infected, it's called prostatitis. This can also lead to increased PSA levels because of the inflammation. Urinary tract infections, UTIs, infections in the urinary tract can temporarily raise PSA levels. These infections can affect the prostate gland and cause the PSA readings to be higher. Recent prostate procedures. If you've recently had a procedure like a prostate biopsy or surgery, it can cause a temporary rise in PSA levels. Timing is important to consider when interpreting PSA results after such procedures. When doctors look at PSA levels, they consider your medical history, any symptoms you might have, and the presence of non-cancerous conditions. This helps them accurately interpret the PSA results and decide if further investigation or treatment is needed. Final thoughts. In conclusion, prioritizing your prostate health is crucial for overall well-being. The PSA test offers valuable insights into your prostate health status, enabling proactive management and early intervention when needed. Take control of your prostate health. Today, schedule your PSA test and ensure peace of mind. Don't wait, start prioritizing your prostate health now. Early cancer detection can always be treated. Remember, prevention is always better than cure.